a look forward to 2026. Hoosier families face childcare concerns. Indiana residents not immune to economic woes, and campaign funding starts to add up. From the television studios at WFYI Public Media, it's Indiana Week in Review for the week ending January 2nd, 2026.
Indiana Week in Review is produced by WFYI in association with Indiana Public Broadcasting Stations. Additional support is provided by Har Ritchie.
Childcare is a crisis in Indiana. After the state slashed funding for vouchers, more families are struggling to afford care, and a growing number of daycares and preschools are closing their doors. Dylan Piers-McCoy reports that lawmakers are looking for ways to make care more affordable without increasing state funding.
Indiana used federal pandemic aid to substantially expand the number of child care vouchers for low-income working parents. When that money ran out, the state froze enrollment and reduced reimbursement rates. That's left daycares and preschools vulnerable to closure. A recent analysis from Early Learning Indiana found the state lost more than 1,000 child care spots from mid-August through November. Republican legislative leaders say the state is unlikely to increase funding. Instead, they hope to reduce regulations and encourage more informal, low-cost care. Democrats have floated other solutions, including allowing local communities to ask voters to raise property taxes to pay for child care.
So what can or should the state do to address this crisis? It's the first question for our Indiana Week in Review panel. Democrat Ann DeLaney. Republican Mike O'Brien. John Schwantes, host of Indiana Lawmakers, and Ebony Chappel, Director of Brand and Community Strategy at Free Press Indiana. I'm Jill Sheridan, Managing Editor at WFYI. So, Ann, do you think Indiana legislators are going to be able to help or offer any help for Indiana families that are struggling with child care?
If they put the money where they should, yes. I mean, changing the regulations, you're actually giving parents the choice between putting their children at risk for safety or working. You know, it's crazy. They took this, we had 30,000 vouchers, and these are, by the way, not the vouchers for private schools, which they did expand for the wealthy people. These are vouchers for childcare for people who need it. And we cut them from 30,000 to 15,000. And then we cut it from 300 a week to 150 a week. It is ridiculous. We want people to work. When they work, they pay taxes. When they pay taxes, the state revenue grows. And we need to assist on this. If we're not birthers and we're really about right to life, then we ought to be helping these parents make the transition to good quality daycare and preschool, and we show that when they have that, they do better in school. They're less likely to wind up in prison. There are all these down-the-road advantages of doing this, and it's very short-sighted on our part. If we just did, you know, the equipment taxes that we're playing with, where you're not going to pay anything for $2 million, and now you're going to be able to depreciate any equipment you buy completely in the first year, that costs us hundreds of millions of dollars a year in tax revenue, more than enough to not only replace what was taken away, but expand it for the people who need it. It is shocking that we don't do that.
Well, should we put more priority here? You know, we have a brighter budget forecast. Should Indiana lawmakers be looking at ways that, you know, we can close the gaps for families? Because right now, a lot of people are struggling.
Yeah, well, they are looking at it. The idea that you can do it without actually paying for it seems unlikely. But I do think you look at this and enhanced premium subsidies for, you know, health insurance policies and these other COVID era things that were provided. You know, we spent one-time money on a thing that we thought that you enhance these things and you spend these enhanced dollars at a time of crisis, thinking that people, like, the needs are going to go away, and they don't. So you've either got to decide it on the front end that, like, look, unless there's a guaranteed way to pay for this forever, we're not going to take it on to begin with. But we did, and in this and a lot of other areas with COVID dollars, we were flush for a while, and now we are not. And we're even with the relatively rosier budget forecast that comes out of the doom and gloom forecast that we're still trying to, climb out of. I thought the Democrats' ideas, the one mentioned about local property tax referenda, right. I like that. I don't know if we should, how you do that really matters on how you're going to bring tax dollars and give it to private child care services. But
like charter schools.
So there's some ideas here that I think are worth exploring. That was a Republican idea, by the way, way back when, to allow locals to increase their own property taxes if there was a community need and the community priority. So why not?
I think.
But deregulating and loosening requirements and stuff, I don't think that doesn't get
you near where you need. It's not going to do anything. And if we stop the tax cuts, okay, if we stop giving the money to the wealthy, the vouchers to the wealthy, to the businesses buying millions of dollars worth of equipment, depreciating it in 1 year instead of 5, if we stop doing that, we could do this. All the cuts that we do in this state affect the poor and the people who need it the most. And that's what's shameful about it.
Well, I think all the, data does show, John, that, the high quality care is really what families do need and can benefit from. And, there was that initial investment with the pandemic money, but now we're seeing, such a pullback on that. How can we get back to a place where we're lifting,
It's not as if the General Assembly is unaware of this issue. And in fact, they sort of declared a crisis a couple of sessions ago and did make some of the regulatory changes in terms of the age of the people who have to be, what age to oversee the care of children, how many people can be in the care of a professional caregiver. And that was changed. But now the ball's moved, the funding has changed, and we've seen some child care operations go under, a couple dozen maybe, just since this summer, because of not only the sort of the freeze of that waiting list, but then the scale back of the reimbursements. I think states eventually will probably have to do what, say, New Mexico has done and say this is an economic development issue. We can differentiate ourselves from the rest of the country. So just last month in November was the launch of universal care. It doesn't matter what income you have. You can get a voucher for quality, and even grandparents who are providing care. Other states, Connecticut does a little differently. They have a relatively new law in place where it's a salary, $100,000. If you fall below that in terms of household income, I think it's maybe 7% is the max you can pay on child care. So there's a cap. And the newly elected mayor of New York has made certainly child care a priority too. So we've seen one state do it. We've seen a large jurisdiction municipality with New York trying to do it in other states. Are we going to have universal care here? No. But I think this state and every other state will have to wrestle with this issue, because when you have people, there's a demand for people in the workforce. I mean, something's got to give.
Do you think, in Indiana as well, we've heard, that solutions might be, just have family, care for, bring your baby to work, possibly. But, do we have any hope of really, coming back to this high quality, care position, knowing that this is what is going to move these children forward?
I think it is imperative that we do. To your point about just, family or bringing them to work. Telling people to bring their children to work is not going to cut it. Telling them to send the children with family is not going to cut it, because what if everybody in the family is working? We want people who have the ability to work. That helps. Rising tide lifts all boats, right? That helps everyone. And the quality, I think, is an issue as well, because there's been talks of lowering the standards and the regulations to create more access so more of these centers can open. So then what happens when we end up in a situation where we're just sending our children anywhere? That, to me, is unacceptable. One of the bright spots that I've noticed recently is the involvement of philanthropy, which I think is a good step in the right direction. We shouldn't rest on philanthropy just solving every problem, but I know that Glick Philanthropies, for example, in Central Indiana, has stepped up to help support providers so that they can expand their capacity, whether that be through reutilizing their buildings to be able to bring more students in. So capital improvement is really what that's focused on. And there are some other examples as well out of the United Way of Central Indiana and in other communities. I think that is a bright spot. However, the state has to see this, and John, I think you bring up a good point. They have to see this as an economic driver, because when people are able to put their children in a safe space, they're able to go to work without that worry on their minds, and then those children are then more properly equipped to step into pre-K and kindergarten and know what's going on. We have situations now where kids are going to school and they don't know how to write their names because they haven't had those crucial early steps. So I think the legislator has got to get it together. They've got to get it together when it comes to this issue.
Some of our lawmakers have even labeled this an infrastructure issue. They see it as no different from access to water, access to sewer and roads and sidewalks and libraries.
It's that crucial. I think a lot of times when we separate these issues into a special interest group, like apparently women are the only ones in charge of children, so if we can just, you know, shuffle it over there, it's a special interest issue. It's not on the slate of what we think are important issues. And this is, I'm so glad you brought up that point. This is just as important as any of those other things when we think about the overall health of our state long term.
Well, I mean, it will be an economic issue continuing forward, as well as so many things that we're talking about right now. And the cost of living continues to climb in November. Through a little less than 2 months ago, as of 7 in 10 Americans say that they're barely able to pay their bills, and this is according to reporting from NPR. Consumer prices in November were up 2.7% from a year ago, according to a recent report from the Labor Department. The department did not provide an October comparison because the government shutdown kept workers from conducting their usual price checks that month. Forecaster Inflation Insights suggests the absence of rental data from October may have skewed the November inflation figure lower. The data comes as growing concerns about affordability remain a drag on President Trump's approval rating. So affordability is a buzzword right now. Where do you think Hoosiers are really feeling the pain, Mike?
All the high-impact stuff that's still dragging. We've gone a long way from 9% to 2.7%. Getting from, the economists say, getting from 3 to 2 is going to be painful and hard. The things that are driving it right now are housing. Food is still nagging. It's come down, but it's still, you know, if you look at the statistics from November and previous months, it's come down, but it's still expensive. The bright spots are, you know, things like meat, things like gas prices are down, or they're at least flat year over year. So there are some bright spots in the economy. There are parts of the economy. I think the perception for a lot of people, I think, is that the economy is just humming right along because the Dow's at 48,000, and that does benefit a lot of people, including Middle America. But there's still work to be done. I think coming out of COVID, we part of this was going to resolve itself because we flooded parts of the economy with a lot of money, and that drove inflation. Predictably, right? And especially when you target it at certain industries and certain places, of course, it's going to drive up the cost. Services are driving inflation, but the good news with services, it's kind of a double-edged. Or there's a good side to that story, and the reason that inflation is still being driven by providing services is because the wages of those service workers have gone up so much in the last 5 years. And when they go up, they don't come down. It's like a sticky inflationary indicator. It just once it goes up, it stays there because you're not going to go in and go, well, you're making $16 an hour, and now you're making 12. So
unless you want to eliminate your workforce.
So we can lower the price of dinner, you know, dinner going out. So there's a lot of factors at play. It's certainly better than it was a couple years ago, but you know, people are still feeling it in some key areas. Housing is just something we've got to figure out generally. Inflation or no inflation, housing is driving a lot of issues for especially lower income people.
And I mean, you know, the president can say that affordability is not a real issue for people, but you can't tell that to, you know, the mom that's going to the grocery store and sees, you know, coffee
or the young person who would like to buy a house. Yeah, you can't tell them that.
So that's not going to be, you know.
No, and coffee's going through the roof, absolutely through the roof. So the inflation is really 3%. That's what all the economists are telling us. They just don't have the November figures in there because of the shutdown. But that's the same inflation rate it was when President Biden left, okay? And we did have inflation, obviously, during COVID, and it was, in many ways, it was intentional. He was trying to prevent a recession, and it worked. Okay, and there was a
Donald Trump
byproduct
did
of that.
too. I mean, the first stimulus after COVID was Donald Trump's.
Well,
and then,
okay.
then Biden doubled down on it.
That's right. And
Then we wondered why prices were up.
knowing it was going to increase inflation.
Yeah.
So, all right, it's coming down. It's not coming down the way it should. And the other problem we have is that the chaos surrounding the tariffs that are out there, you just don't know from one day to the next whether something you're looking at buying as a big investment is going to be at one price or it's going to be double that price. It really is leaving a lot of uncertainty for people. And that coupled not only with the housing prices and the cost of food in the grocery store, but even to go out to dinner anymore. I mean, that price has gone up dramatically, partly service, but also the costs of the goods provided. So it's a worrisome thing, and it is you cannot tell the people that are looking at what the dollar is not stretching as far as it used to that you're doing fine. You can't do that. I know the president's trying to do that, but it's not going to work.
What do you think, Ebony? I mean, people are feeling it. There's no doubt about that. We have a rosier forecast for the state. They're going to be making a little bit more money, hopefully. Are regular Hoosiers going to be making a little bit more money and hoping to make these ends meet?
I think we would all hope so. We would all hope that Hoosiers can have a little bit more money and experience a higher quality of life. But to the affordability issue, what I think is going to happen is that you're going to see more and more people become, for lack of a better word, radicalized by the lack of affordability, because there's no way that an elected official can keep telling you, it's raining, and it's not rain you're feeling.
No,
that's something
right.
else. You guys catch my drift. Yeah, or doing anything that might help that situation. When we talk about housing, for example, here in Indiana, we are seeing a continued issue of a lack of inventory. You have a lack of inventory and then no regulation on the behalf of these landowners and landlords, a lot of them slumlords, these investors coming in. So it's creating this environment where people cannot find a place to live and they cannot find affordable, safe, comfortable places to live. So it just creates, more of this chaos. So I think what's going to end up happening is the people that are not paying attention, they're going to see that on the other side when people show up to the polls and they're paying attention. You talked about New York City's new mayor, and we know that a lot of what drove that was his insistence on making the city more affordable. So that is the name of the game right now.
The other thing that's important to know about the affordability of housing is it's not just here. It's worldwide.
Absolutely.
And it's partly the function of a variety of different things, not just cost, but also not in my neighborhood, or I'm building a house and I need 5 acres, or you can't put aluminum siding on, all of those things together, which requires, it seems to me, again, just like the utilities, a step backwards, and let's look at what all the impediments are to construction and figure out a way to solve that so that we can build what we need to build.
Yeah, and there are solutions that exist. We just have to be willing to explore them. Yes.
Whether it's the New York mayor or, whomever, it's going to be an extremely difficult job to bring prices down for your average Indiana resident.
There's not a switch you can just flip. Even if you had the political ability or wherewithal to take the hits, it just doesn't work like that. Yes, the market was flooded during the pandemic by design to ward off a recession, but also there were supply chain issues. So there was increased demand. People had more money in their pockets temporarily, and they were willing to buy things, but the things weren't there because they were,
you couldn't find
tied off. Ships weren't unloaded for weeks at a time just because of the pandemic. So, and this doesn't affect everybody the same. On one end of the spectrum, it's like, I'm going to get a different, cheaper cut of steak instead of the, filet. But if you look at childcare, if you look at basic utility costs, if you look at food. If you're trying to just squeak by, it's not, I'm going to go out to eat 3 times a week instead of 7, or different cut of prime rib. I'm just trying to figure out how to keep the kids fed.
Right. It's going to be an issue that we are closely looking at, as well as candidates for the 2026 Indiana Secretary of State race, a race that we'll be definitely following. We're already pooling campaign donations for that race. Zach Castle reports that since he announced his candidacy in October, Democratic candidate Beau Bayh has gathered dozens of large donations.
Bayh is an attorney and the son of former Indiana Governor Evan Bayh. He has already raised at least $1.16 million in large donations. About 60% of the funds are from donors with out-of-state addresses, while about 40% are from Indiana donors. These include Maryland-based billionaire Robert Johnson, Chicago-based attorney Dan Webb, members of the Indiana-based Simon family, and former Indianapolis Mayor Bart Peterson. Incumbent Diego Morales, a Republican, has reported at least $911,000 this year, and Blythe Potter, a Democratic challenger, has raised at least $20,000. The annual filing, due in January, will give a clearer picture of the candidates' finances.
So, John, these are some big dollars that we're seeing. Is this a forecast of things to come?
Well, every race is getting more expensive. Look at some of these legislative races are unimaginable numbers based on what we would have seen 10, 20 years ago. But it used to be this was a seat. People weren't necessarily growing up wanting to be the Secretary of State of Indiana and be the keeper of the seal and give back unclaimed property. It was seen as a stepping stone. That's why you don't want to do that. You can't even give back the property anymore. Police securities, that's what we'll do. That's his father. Another member with the Bayh name used the Secretary of State's office as a first step. Back in '86, and it worked. And so I think people have viewed that seat. It hasn't always worked as the springboard people hoped, but I think this, because of the name involved, and keep in mind, again, his father knows a few people. Yeah. I'm not surprised that money's coming from outside Indiana, given his tenure not only in the governor's office but in Washington in the U.S. Senate.
It's probably better that it's coming from outside Indiana than from the people he's supposed to regulate, which is where Morales' money is coming from.
So are we going to see this trend continuing, Mike, as we move into the 2026 campaign? And
the funny thing is, it's like the first step is the convention, and so these guys are going to walk in the convention hall with $2 million in their pocket and not need any of it, maybe ostensibly. So the Republican convention's in Fort Wayne this year, so it'll be interesting to see how that plays out. Sometimes those out of central Indiana conventions get a little dicey in terms of the people in the room. So we'll see how ours shakes out. But the out-of-state, it's funny, like the first instinct I have, because I've been doing this a long time, is like to go on the attack for the out-of-state money, but that ship has sailed for everybody. Like most of this money is coming from out-of-state. There'll be national secretaries of state organizations, political organizations that spend in this race. I think Republicans need to take it, as I've said on here before, we need to take it seriously. The outcomes are not automatic for us anymore, and we need to start thinking that way again. And really make sure we work this.
This is going to be a competitive race, Ann.
Oh, it certainly is. I think the Republicans will nominate Morales again, and he has a long list of things that he has to be accountable to the voters for. And the problem, from our perspective, from the Democratic perspective, we haven't had the resources to tell the voters about the problems with Diego Morales. We'll have those resources this time.
Do you think Diego has a chance? And he's a lot of critics across the state.
Yeah, looking at that approval rating, not an Ice Cube's chance and where. I don't think so. I think it is really interesting to see.
You got a lot of shade on him in 22.
Yeah. Well, I think, it is interesting to see so many people, especially such high-name people, interested in this race. You think about Bob Johnson, the founder of BET. Like, what does he care about the Indiana Secretary of State? Outside of, I think, one big thing, the Secretary of State runs elections. So that, to me, is a very compelling point in this whole conversation. So I'm interested to see how it all works out.
Well, as Indiana lawmakers have filed bills to expand how the state carries out death sentences, reporting debate over capital punishment that stalled in the State House earlier in 2025, according to our reporting partners at Indiana Capitol Chronicle. At the heart of two bills are additional execution options beyond lethal injection, which is currently the only method authorized under Indiana law. One bill authored by Indianapolis Republican Senator Mike Young would allow Indiana to use a firing squad to carry out executions under certain circumstances. Under Young's proposal, the death penalty could be inflicted by firing squad if an execution by lethal injection was not possible. A House bill authored by Republican Representative Jim Lucas and Andrew Ireland would allow executions to be carried out either by firing squad or nitrogen hypoxia. Lucas said lethal injection would remain the default method. So, Ebony, are these solid solutions for the capital punishment question in Indiana?
I think a solid solution is to look at something that doesn't cost Indiana hundreds of thousands of dollars for one dose of lethal medication, that is not costing us millions of dollars. We can't even access the meds that they were trying to use. I think there is a strong argument for just letting go of it altogether, and I think that's something that the state should explore. It's telling to me that Representative Lucas is framing this as just a simple bill, but adding on that this is an ask from the White House. I think that we have learned a lot in the past year about ask from the White House.
Mike, we would get a lot of attention if, these bills move forward in a timely manner.
We would. I'm not for the death penalty. As a Republican, I can't square it with my conservative brain that if I'm not going to trust the government to run health care, that I should trust it to kill people irreversibly. And that was Barry Goldwater. That was Barry.
Way to kill somebody?
That was Barry Goldwater's position, by the way, and William F. Buckley and Ronald Reagan at the end of his presidency when we were getting it wrong and needed to end it.
Yeah, well, this is a distraction.
That's Indiana Week in Review for this week. Our panel has been Democrat Ann DeLaney, Republican Mike O'Brien, John Schwantes, host of Indiana Lawmakers, and Ebony Chappel, Director of Brand and Community Strategy at Free Press Indiana. You can find Indiana Week in Review's podcast and episodes at wfyi.org/IWIR or on the PBS app. I'm Jill Sheridan, Managing Editor at WFYI. Join us next time because a lot can happen in an Indiana week. The views expressed are solely those of the panelists.
Indiana Week in Review is produced by WFYI in association with Indiana Public Broadcasting Stations. Additional support is provided by Par Ritchie.